My name is Matt. I'll be your student physical therapist today. How are you doing?
Doing pretty good.
Awesome. Could I have you confirm your name and date of birth before we get started?
Yeah. March 25th, 1995, Christopher Parks.
Awesome. Okay, so today we're just going to do a cardiac exam to examine your heart health today, okay? Okay, and before we do that, could I just ask you a few questions first?
Yeah, sure.
Awesome. Okay, I'm just going to sit down here. So it says here on your intake form that you have essential hypertension. Is that correct?
Yeah.
Okay. Is there any other current diagnosis that I should be aware of at this time?
No, other than that, I've just been diagnosed with that about, I think, 8 months ago.
Okay. And as we await your lab and diagnostic results from your physician, are you taking any medications currently?
Yeah, Lucena.
Okay. Do you think it's working for you?
Yeah, my blood pressure's going down a little bit.
Okay, perfect. And then at what dosage do you take that Lucena?
Yeah, 10 milligrams a day, every day.
Okay. Do you have any history of cardiac events I should be aware of?
No.
Any diabetes?
No.
How about high cholesterol?
No.
Okay. Do you smoke at all?
No.
How about drinking?
Yeah, I have a drink on a special occasion out with friends or something like that.
Okay, and how many drinks would you say you drink on occasion?
Oh, 1 or 2.
Okay. Any family history of disease I should be aware of?
No, but my mom has high blood pressure.
Okay. Could you tell me her current condition?
She's pretty stable. I think she's taking a medication similar to mine. I don't know if it's the exact same one, but something
Okay.
similar.
Okay, perfect. Do you experience any chest pain at all?
No.
Okay. Any shortness of breath?
No.
How about with activity, any shortness of breath?
No.
Okay, perfect. Okay, we're just going to do a few exams on you and we're going to check your heart health now, okay?
Okay. Sounds good.
Observations of a cardiac patient begin as soon as the patient walks in. In general, this patient has an alert consciousness level and a normal body type. There's no indication of any scarring or surgical procedures performed. Additionally, the patient does not appear to have any abnormal posture or edema in the extremities. The patient does not show any signs of emotional or physical distress, and his breathing appears normal. The patient is then told to look both ways to examine the neck for jugular vein distension, which can be a sign of heart failure. This patient does not appear to have any jugular vein distension present. Alright, so the first thing we're going to do is just check your heart rate, okay? This is something we're going to do before, during, and after you do any exercise here in physical therapy, okay? We just have you put your arm up like this. We're going to check what we call the radial pulse that's located on your wrist, okay? So what I'm going to do is I'm just going to find that on your wrist here. And then I'm going to use this timer and count for 30 seconds to get and calculate your heart rate. The heart rate of this patient's left radial pulse can be determined and calculated. It is expected between the normal ranges of 60 and 100 beats per minute. Even though heart rate and high blood pressure do not have any correlation, an increased cardiac workload can potentially lead to an increase in this heart rate. Heart rhythm can also be determined to be regular or irregular. We expect in this patient for the heart rhythm to be regular. Alright, now we're going to check your blood pressure, okay? I'm just going to put this cuff around your arm, and we're going to get a baseline, and then we'll find your blood pressure, okay?
Sounds good.
Is that nice and snug on you?
Mm-hmm.
Okay, perfect. Alright, we're just going to get a baseline. Can I have you flip your arm over for me? Thank you. Now we're going to find your blood pressure here. This patient, as we know, has been diagnosed with essential hypertension. However, it is being controlled by medication. We would expect their blood pressure levels to be normal or maybe even elevated. Their systolic level will be less than 120 or as high as 129, and their diastolic should be less than 80 millimeters of mercury. However, if the blood pressure is not being controlled, we could expect blood pressure levels characteristic of hypertension stage 1 or stage 2. This can result in systolic levels of blood pressure as low as 130 millimeters of mercury, and in critical cases, as high or greater than 180. Diastolic levels, on the other hand, can be as low as 80 millimeters of mercury, all the way up to, in critical cases, over 120. All right, perfect. All right, so I had you take off your shirt in order to locate a few bones on your chest to make sure there's no cracking or popping in that area, okay? If it's okay with you, can I feel around for those bones in your chest? Yep. Okay, so we're just gonna take the top of your sternum here. Perfect, and then we're gonna check all along your sternum. Make sure everything's okay. Perfect, and then we're just gonna check each rib connection with the sternum on both sides. This patient does not show any abnormal findings upon palpation. Alright, so the final thing we're going to do is we're just going to listen to some heart sounds, okay? I'm going to listen to heart sounds in 4 different places, 1 on your right side and 3 on your left side, okay? Put this on. Okay. Upon auscultation, no abnormal findings were present.